We really don't like talking about this. It's extremely uncomfortable. So this is a warning up front. I'll be using as neutral language as I can, but if you have really intense bottom dysphoria and even hearing about certain anatomy makes you uncomfortable, you might want to sit this one out. It will all be very PG-13, and I won't show you any nasty surgery photos. Another warning, I am not a doctor, or in any way qualified to dispense medical knowledge. I will not make judgments on whether or not medical transition is necessary, or the right or wrong thing to do. This video is about hurdles that I and other people I have spoken to have run into regarding medical transition and sexual health, specifically in a transmasculine context, specifically in America, specifically in Texas. Transmasculine, in this video, is the most inclusive word I can think of to describe a person with a uterus who is not a woman and who is on testosterone HRT. I know that word has a nebulous definition, but I want to make sure we're all on the same page for the next 20 minutes. My name is Dylan. I'm a trans man. I use he, him. I'm 24. I've been on testosterone HRT for a little over 1 year. I'll be treating this topic as delicately and as honestly as I can, and I'll also be telling a lot of personal stories, so be nice to me. If you're cis and you find details of medical transition fascinating, with all kindness, I ask you to keep it to yourself. I'm not making this video to be ogled. Let's talk about transitioning with ovaries. Part 1. Informed consent. I've been terrified of pregnancy since before my first cycle. The way mothers had described it to me, it was pure body horror. 3/4 of a year, you don't have control over your appetite, your moods. You need help doing basic things. Your body twists and distorts and stretches until it will never be the same, all to accommodate this organism growing inside your body. To me, it was even more terrifying than imagining a bug burrowing under my skin to lay eggs, because with pregnancy, your whole body is co-opted and taken away from you. I don't say this to scare anyone who wants to carry a child, it's just something I've known I would never want to happen to me. The fact that my body is fully capable of it is probably my primary source of dysphoria. To be sexually active is to live in fear. I tell you all this so you understand the mindset I was in when I set up my first intake appointment with Planned Parenthood to start hormone therapy. Our generation of trans people is unique. 20 years ago, once you realized what you were experiencing was gender dysphoria and that you had decided to seek medical transition, you would have to deal with waiting periods that would last years, see multiple mental health professionals, and come to the clinic with armfuls of certifications that you were actually transgender and actually suffering. Only very recently has Planned Parenthood allowed you to get hormones with informed consent, in accordance with the updated standards of care published by the World Professional Association for Transgender Health, or WPATH. Prior to the 2012 edition of the Standards of Care, months of psychotherapy and/or a period of living full-time in your target gender was a prerequisite to even hormone therapy. Now, letters from mental health professionals are still usually required for surgeries and recommended for HRT, but are not needed if the clinician, or even the surgeon, if it's top surgery at least, is qualified with mental health care or experienced with transgender patients. If you've ever had a medical professional ask you if you wanted to start a treatment and explain to you that treatment's effects, benefits, risks, side effects, possible alternative treatments, you already have experience with informed consent. It's a very common approach to medicine that takes into account both the doctor's expertise and the patient's autonomy over their own body. The provider and the patient work together to ensure the patient undergoes a treatment they understand and have decided is the best path for them. It is certainly a better approach to transgender health than the previous standard model of care, which assumes that neither the physician nor the patient is capable of making an informed decision on whether a treatment is the right course of action, but a mental health professional is. In an attempt to avoid approving transgender services for people who aren't actually transgender, this system sets up months, sometimes years, of gatekeeping for people who really need the care. Trans people are then, ironically, less likely to seek a therapist for recurring dysphoria or other mental health issues, and instead see mental health professionals as an obstacle. I'm extremely grateful that informed consent was an option for me. But it's not perfect. There's only so much they can inform you of. This is how my intake appointment went.
Hello? Dylan, right?
Yes, Dylan, that's my name.
Gotcha. Says here you're interested in starting hormone replacement therapy.
Yeah, I want thinner hips, a deeper voice, more upper body strength, no periods. Those are all things I know testosterone does. I have negative dysphoric feelings about those parts of my body, and it's been getting worse. I've known that I'm not a girl for a long time.
Sounds like you've already done a lot of research.
Yeah.
You use the word dysphoria very confidently.
I've been thinking about this for years.
Well, we'll have to do some blood work to see if it's safe. Why don't you look over this packet?
Okay.
Now, testosterone puts you at a greater risk for things like heart disease, diabetes, things we already know men are at greater risk for. So we have to check your red blood cell count and current T levels so we would know what dose to start you on.
Yeah, I've been talking to some other trans guys about bottom growth as well. It seems a little weird to me, but everyone I've spoken to says they'd like it more than they thought they would.
Well, that's great that you already have that support system. Honestly, you seem very informed already. Now, when it comes to facial hair and male pattern baldness, that depends on your genes and whether the men in your family have hair. You'll also experience an increase in sex drive and mood swings and acne like any boy going through puberty, but those should even out over time. Do you have any questions at all?
Yeah, this says you will probably stop having a period. I thought the period always stopped.
Usually, but it varies from person to person. That can't be promised.
Can I still get pregnant?
There's no way to be sure. Some guys can't after prolonged treatment, but that should never be assumed. We should talk about birth control if that's an issue for you.
What about things like cervical cancer, ovarian cysts, endometriosis?
Well, there's no evidence that testosterone puts you at higher risk.
This says there may be long-term risks that we don't know about.
Well...
Part 2. Women's health. When I talk about my discomfort with having a uterus, having periods, taking things like birth control and Plan B, some people roll their eyes a bit. Come on, no woman enjoys having periods. That doesn't mean you're trans. And that's kind of right. Having a uterus is terrifying on its own because even with the transgender context removed, the health of uterus owners is historically under-researched. I could take it back all the way to the pre-psychology days when damn near every problem a woman had was diagnosed as hysteria, but even until today, women are excluded from research studies that should be general population, for reasons like we wouldn't want to accidentally impact a young lady's fertility with an untested drug, or it would be too hard to account for different periods in the menstrual cycle. It's been less than 50 years since we discovered that women don't have the same heart attack symptoms as men. Even in tests on drugs and cancers that are specific to, female anatomy, the research subjects are majority or all cisgender men and male mice. Add to that the lack of research in transgender populations. Even when trans people are studied, it is almost always primarily trans women, with factors like whether or not they are on HRT not even recorded in the data. When trans men are included, they still run into the outdated idea that transgender people are just super gays who transition to have access to the much larger heterosexual dating pool, and the assumption that trans men as a group don't use their vagina during intercourse. It's the same blind spot that causes the misconception that lesbians can't get HIV. People just have no idea how the sex works. So for someone like me, someone who has penetrative sex in the front hole, with someone who produces sperm, but is a trans man who doesn't have periods, I have a lot of the same reproductive health concerns that a cisgender straight woman would have. And there is barely any frame of reference to answer my questions. A lot of the ways cis women get answers to these questions are completely useless to me because they assume I have a menstrual cycle I can keep track of. And when it comes to questions of what testosterone will do to my reproductive organs, the only answer I get is, no one really knows. The research just isn't there. So the clinician signs the line that says I've read the packet and been informed to the best of their ability, and I check the box that says I would like to start testosterone. guess I'm ready. Part 3. Fear of care. Anecdotal evidence suggests that trans men, as a group, experience higher rates of cervical cancer and are 10 times more likely than cis women to have abnormal pap smears. There has been next to no research to determine whether testosterone use exacerbates this, but the dominant theory is that this happens because transmasculine people avoid pelvic exams. The cancer doesn't get discovered until it's too late to treat, and a disproportionate number of us will die. If you know anything about what happens in a pelvic exam, you know that it's already an extremely uncomfortable and, at worst, humiliating experience. And if you were paying attention at the beginning, I'm sure you can figure out that that discomfort can be truly unbearable for FTM transgender people. But it would be disingenuous to place all responsibility for this issue on individuals saying, "Ew, icky, I don't want to do that." Though I will say that no longer having a period and not having vaginal sex does not exempt you from the need to get paps. Even without considering the barrier of psychiatric evaluations, every part of the healthcare experience is a potential obstacle for a transgender patient. The ambulance driver responding to your 911 call might refuse to touch you or be negligent in his care. Depending on what name they call for you in the waiting room, you could be outed to strangers. You may be asked invasive and irrelevant questions about your anatomy and your sex life by your provider. You may run into broken arm syndrome, where every ailment, no matter how obviously unrelated to your transition, such as a broken arm, is somehow blamed on your hormone usage. You may be approved for a procedure by your doctor, but the doctor actually performing the procedure may refuse to do it. You could get your prescription without issue, and the pharmacy may cancel your prescription when you come to pick it up because they can't think of a reason why a man would need estrogen. These are all manifestations of medical transphobia, the legality of which is currently up for debate in the United States. On May 24th, 2019, the United States Health and Human Services Department, under President Trump, proposed a rule change to the Affordable Care Act denying anti-discrimination protections to transgender patients. This would go into effect January 2020. 13% of trans Americans are uninsured, compared to 10% of the general population. And of those insured, many of their plans don't cover transition-related expenses at all. If transition expenses are covered, it's usually with the caveat that you gotta get that damn letter. This rule, in conjunction with the religious freedom rule proposed earlier the same month, would allow insurance companies to deny all coverage, not just transition expenses, to transgender Americans, and allow medical professionals to refuse to treat any LGBT patient for personal reasons. It would turn all those obstacles into barriers against which trans people have no legal recourse. And when people don't have access to healthcare, they die. Quietly. At home. Or killed by people who got the message that we don't have the right to a healthy life. There are also obstacles that aren't so much discriminatory as they are fiddly and inconvenient. I can't speak for estrogen users, but testosterone can be surprisingly hard to get a hold of. Shortages happen, and prescriptions sometimes sit unfilled in the pharmacy for weeks waiting for a shipment. It's taken either weekly, bi-weekly, or monthly in the injectable form, and it's honestly not that big a deal if you miss a dose. But once you miss a few, your toilet paper might start coming back red, and that's gonna be a whole thing. Sometimes I need a separate prescription for needles and syringes, sometimes I don't. This tiny vial, without insurance, with good RX prices, is like $30. Sorry, I'm a little out of it. Why does it hurt? Why does it hurt so bad? What's wrong with me? What's wrong with me? What's wrong with me?
So, it's actually very common for people in your position who have been taking testosterone for a while to have the sort of pelvic pain you're describing. You said it feels like period cramps.
I don't like calling them that. I call them stabbies, because it feels like getting stabbed in the abdomen with a kitchen knife. But there's no blood, and it can last much longer than any period I ever had.
Usually this doesn't start happening until someone's been on hormones for a few years.
Yeah, I'm only at 9 months right now.
Well, it could be a lot of things. Endometriosis, fibroids, and PCOS are common culprits. It doesn't sound like PID, and your last PAP came back normal.
I might feel more comfortable if you did a PAP anyway. Things have been Really dry?
Oh, well, that's another common problem with testosterone. I can tell you to use lube and prescribe you some estrogen cream for that, and going on progestin-only birth control might help with the pain as well.
So the solution to my problem is to take female hormones?
Well, just in the meantime. You wanted a hysterectomy anyway, and that should fix the pain problem too.
Should. I guess it's nice to have a medical reason.
Yeah.
Why is this happening to me?
I wish I could tell you. I've worked with enough trans men to know this is a thing that happens. But there's not enough research.
Is it my fault?
No. You shouldn't blame yourself if you know taking hormones was the right decision for you. It's not your fault you had side effects.
Part 4. Man pain. I'm lucky I was able to work with such an understanding provider through all this. Even for cis women, it's incredibly difficult to get pelvic pain taken seriously. For people with a uterus, pain is supposed to happen, which makes the problem hard to identify and difficult to convince anyone it's a problem. For transmasculine people, all too often these phantom cramps are brushed off as a psychosomatic effect of gender dysphoria, and you get sent to a psychiatrist instead of a gynecologist. All of these potential causes of the mysterious pelvic pain trans men can go through can impact fertility, and obviously birth control and hysterectomy do as well. I'm also lucky in that since my dysphoria about pregnancy is so severe, preserving my fertility is of no concern to me. But that's not the case for all trans men. If you want to have your own children with your own equipment, fertility options are scarce. Freezing your eggs before starting HRT is much less accessible, less straightforward, and more expensive than freezing sperm. And when something starts going wrong in the oven, treatment without sterilization is finicky. And this is assuming you even have a choice in the matter. Certain jurisdictions require sterilization as a barrier to things like getting an updated birth certificate. But on the flip side of that, hysterectomy can also be a difficult surgery to get, especially if you're young and living in a pro-life political environment. Even if you are suffering from crippling pain, not only is it supposed to hurt, you're supposed to have pretty white babies. Doctors are extremely hesitant to perform hysterectomy on a 24-year-old with no children. Any woman who's been forced to do a pregnancy test before being treated for an emergency issue is aware of the medical world's strange fixation on preserving the function of the uterus and the safety of a potential fetus. I know one cis woman who suffered from endometriosis and had already had 3 children who continued to be denied for hysterectomy until the endometrium got infected. My doctor also praised me for doing it in the right order, meaning I was pursuing surgery before my legal name change. Everyone's path to transition is different, but this right order he was talking about is the path with the fewest obstructions. Depending on your local laws, you may need a doctor's note that you have made permanent and irreversible changes to your body in order to change your gender marker. But of greater issue is that insurance and name changes don't get along. And if, for example, you are a trans man who has just updated his insurance with his new legal male gender marker, you may no longer be covered for any sort of vaginal, uterine, or ovarian health care. Those are women's health issues, and men don't need to be covered for them. Picture this for a moment. Something hurts very badly in the mystery box inside your abdomen. For some reason, it's taboo to tell anyone it hurts more than you're used to, and it's impacting your ability to do everyday things. You suffer in silence until you can't anymore. A medical professional might have answers to your questions, or maybe they'll just say that's normal and send you home. Make the appointment, walk past the people outside the Planned Parenthood with the Confederate flags and the signs that say pray to end abortion and trans is a lie. Look around, and you'll find you're the only man in a waiting room full of women. Part 5. What it means and what to do. I started this channel because I wasn't seeing the full truth of my experience on YouTube. I noticed there were parts of the trans experience that only trans men could talk about. This is one of them. And yet, time after time, I see transmasculine people opting out of discussions on their reproductive rights because it is so uncomfortable, so painful, and so dysphoric to talk about these things, and it will change the way people see you if you bring it up. As much as informed consent streamlines the process, Particularly when it comes to FTM transition, there's a lot that's unclear when it comes to long-term risks, and you can really only be informed or prepared to a certain degree. I don't regret starting hormones, and I will continue taking them forever if I can. But everything I've talked about in this video is something I wish I had been told earlier. So now you know. For all the turfy fuss about men trying to get into women's spaces, I am literally a man who literally needs so-called women's spaces like the gynecologist. When women's reproductive rights are under fire, so are mine. It's very important that we know that and care about that. If you're cis and phrases like pregnant people and people with vaginas rub you the wrong way, hopefully this video gives you enough context to understand why that language is necessary. If you're American, make sure you're registered to vote, and make sure your candidate actually intends to roll back Trump-era anti-trans policies and won't treat trans issues as too hot button to take a stance on. If you're trans and you ever get the opportunity to participate in a research study, do it. You usually get paid, and it's one of the most significant ways you can help future generations of trans people suffer less. That's praxis. And I can't emphasize enough the importance of having trans friends, especially in your area. People who have been on HRT longer than you can tell you firsthand what it's like, what problems you might run into, recommend you a new pharmacy when yours is out of your medication, and lend you needles in an emergency. If that's not available to you, I'm still a small enough channel that you can talk to me if you have questions. I try to respond as quickly as I can to DMs on Twitter, Instagram, and Patreon. I got so sick of suffering in silence, and I don't want you to suffer in silence either. It's okay to talk about your pain. We can fix this. Couple things. I approached this whole video from the perspective of someone who transitioned as an adult. Transition for minors and children is a different process and deserves its own video. This video is not an advertisement for my surgery. I'm just using myself as an example, and I'd hope the script stands on its own. But if you heard all that and thought I want to help him, you can, through the GoFundMe in the description. Time to thank my patrons. Special thanks to AA Ramfushi, Brent Stanfield, Dr. Crackshoe, Gavin Moore, Isabella Lamar, Jacqueline Bristow, Joala, Jay Miley, Jonathan Becker, Len Schweizer, Morn Dogs, Quinn Hart, Sorry, Strong Jess, and my mom for pledging $5 or more. You can become a patron at patreon.com/boyform if that's what you're into. Thank you for watching. I'll see you next time.